our last video we learned a few abdominal exercises, core muscle strengthening abdominal exercises we did perform. So today we'll understand more about abdominal obesity and a few strategies to reduce it. Okay? So what is abdominal obesity? Abdominal obesity is the amount of fat that gets deposited around the abdomen. It may be the visceral fat or the subcutaneous fat, that is just below your skin and tissues is your subcutaneous fats, and the visceral fats, that is all the organs that lie in your abdomen. The fats get deposited around these organs, causing some chronic illnesses. Okay, so fine. So we'll go for to WHO. When waist hip ratio goes above 0.90 in men and 0.85 in women, that is the indication of abdominal obesity, or the waist circumference, which is easier to measure. The circumference when you measure just around below the rib cage, around the abdomen, just below the rib cage, and that is 94 centimeters in men when it goes beyond 94 centimeters, and 80 centimeters in women. That is the indication of the increase in the abdominal circumference, that is abdominal obesity. So these waist hip ratio and waist circumference are the better measures than BMI, that is the body mass index. Let's now have a quick glance at the causes or the contributing factors to abdominal obesity. First, most important is the sugars, the processed sugar especially, in comparison with the sugars in natural forms. Next is the high carbohydrate convert into fats. They convert into glucose, sugars, and then into fats. So we need to keep a check on it. Imbalanced diet, high carbohydrate diet, low carbohydrate and fat, and low proteins and vitamins and fibers in the diet. Influence of endocrine, sex hormones in both males and females is a major contributing factor in abdominal obesity. Females, especially during the perimenopausal period or menopausal period, land up with this problem because of the disturbances in their hormonal levels. Age is an important factor. The metabolic activity, metabolism reduces as the age advances. It's generally said that every 10 years, every decade, there is some decline in the metabolism of every individual. Okay? Inactivity and sedentary lifestyle, we all know that it is the overall weight which we gain, which also contributes to the increase in abdominal weight, abdominal obesity. And it's all because of the inactivity or the sedentary lifestyle we have nowadays. Now, more important is less of lean. When you talk about increase in weight, it is the less of lean body mass, that is the bone and the muscle mass in simple words, and more of fat percentage. If you go for a body composition analysis and get to know the lean body mass, which if it is less, the tendency of fat deposition is surely more. So this has to be increased. I'll tell you how later, by having a good amount of protein intake and a good build-up of muscles, that is muscle strengthening, which will maintain your body mass, lean body mass, and eventually gradually reduce the percentage of fats in your body. Lack of good fats. Now, when we talk about fats, it's a very, very vague term here I'm using, but it is, in simple words, we can put maybe lack of good fats, which is otherwise needed for absorption of vitamins, we know. Those good fats are important. At the same time, the bad fats we talk about, the saturated fats, trans fats, they are all they contribute in increase in weight and overall abdominal obesity. Vitamin deficiencies and micronutrients, when we are deficient with micronutrients and minerals which are scarce or which are not available in all foodstuffs, are to be taken care of. We should, that's why even next is the inactive abdominal muscle activity. When you don't engage yourself in the activities where the abdominal muscles will be recruited, the fat deposition tendency increases. The fat deposition becomes more in abdominal area. So it's very important that you get engaged into activities every day where you use your abdominal muscles, okay? And then there is also a need to exercise those muscles separately. We'll go in the strategies to reduce abdominal obesity. We'll go on for the exercise forms for this. But lack of abdominal muscle exercising is one of the factors. Late night dinner. Now let's understand the significance of preserving muscle mass for reducing all types of obesities, especially the abdominal obesity too. What is sarcopenia? Sarcopenia is depletion of muscle mass with aging. This is by rule that almost every 10 years or every decade, there is some 2 to 3% of loss in your muscle mass. And if there is lack of exercise, that is muscle strengthening exercise or the weight training or the resistance training, what we call, will lead to depletion of this muscle mass, ultimately leading to increase in fat percentage, especially on your abdomen. Poor muscle strength is another factor. If you have less strength, the muscle strength, if it is less, it will influence your muscle mass and thereby. So let's move on to some tips to manage abdominal obesity. Different forms of exercises are very important, play a very important role to manage the obesity around your abdomen. Specifically, I should mention the aerobic exercises thrice or 5 times a week. Strength training exercises are very important to preserve your muscle mass, and strengthening the abdominal muscles in specific abdominal muscle exercises will help to regain or to maintain a good abdominal muscle strength. Dietary modifications and overall body reduction, low sugars, especially processed, and low avoiding late night sleeps to avoid the influence of cortisol hormone, annual body checkups investigating thyroid, lipid profile, estrogen, progesterone in females, and also keeping a check on gastrointestinal health. Inclusion of micronutrients such as antioxidants, fat-soluble vitamins like vitamin A, E in appropriate quantities, and minerals that are trace and available only in few food items. 50% of fibers, 25% of proteins, 25% of carbs with micronutrients containing items in food is a general rule to be followed. Women post 35 should maintain or manage their hormonal health on priority. Premenopausal or menopausal women should go for consultation with a nutritionist for natural food items or supplements such as phytoestrogens for maintaining normal levels of hormones. Breathing exercises, pranayam, yoga, meditation help in bringing back the normal functioning of endocrine system, relieving stress and thereby reducing abdominal fats. Research is on about the use of natural forms of hormones such as bioidentical hormones and hormone replacement therapy. Guys, I have given these tips, a vague set of tips I have given you, but what I expect from this is you people can go explore, search, talk to your healthcare practitioners and work on these important tips I have mentioned. Thank you all. Bye.